Well, COVID-19 has exacerbated the challenges and vulnerabilities faced by many South Africans and particularly persons with disabilities. The findings of a study led by the Institute for Development Studies in the UK in partnership with the Human Sciences Research Council in South Africa and the National Council for Persons with Disabilities in South Africa was released today. For more, we are now joined by the Chief Research Specialist in the Developmental, Capable and Ethical State Research Division of the HSRC, Dr. Tim Hart. Dr. Hart, it's a pleasure to have you here with us on SABC News. Let's talk about some of the findings of this survey. And I do understand that it was an online survey that was that showed what was happening. Talk to us about these findings and really how you kind of interviewed people and got to where you were.
Okay, thanks very much, and good afternoon to your viewers. It was an online survey, you're correct, and we took quite a long route to reach persons with disabilities using all our networks, including government and civil society and business, and also individuals. The survey was ran from the 1st of July to the end of August. And we clearly will have missed some people because it was an online survey. So for numerous reasons, we would not have captured certain groups of persons with disabilities. But we got a very broad spectrum from the results, and we managed to get a total sample of 1,857 people who responded to the survey online, which I think was very good. So I think your next question was about some of the findings.
Yes.
Right. So it was a very long survey. It asked numerous questions. So I'm just going to highlight a few. I think, generally speaking, we found that the conditions of persons with disabilities during COVID-19 are worse than normal. They're never good at the best of times. So, for example, a lot of people have a problem with accessing facilities. They have a problem with communication. In this particular survey, we found that over 60% had problems with communication. This often had to do with the wearing of masks, but also specific groups of people who are deaf or hearing impaired. There was a challenge of getting to facilities, a challenge of being understood by people at public and private health facilities. So that was in the area of communication. I think some of the other interesting findings is that we asked the question to people, in other words, over and beyond your normal challenges that you face. What events did you experience, or not normally, rather, what events did you not normally experience during the lockdown? And here, hunger and food insecurity was paramount. 40% of people ran out of money. Almost 40% went to bed hungry at some time. Another 40% had somebody in the household going to bed hungry at some time. And I think the most shocking is probably that 30% of the people at the time of the survey had actually gone to bed hungry within the past 7 days, which is suggesting that the various measures of the social grants, etc., the social relief of distress grants, those intervention measures are not reaching the people with disabilities in South Africa.
All right, I think that we can carry on this conversation at a later stage. It's unfortunate that we are out of time at this time, Dr. Tim, but we certainly have to have more of a conversation on this very important one indeed. Thanks for giving us your time, and let's chat again at a later stage.
All right, thank you very much.
All right, that is Dr. Tim Hart, who's the Chief Research Specialist in Developmental, Capable and Ethical State Research Division of the Human Sciences Research Council, talking about how COVID-19 and the pandemic in general has affected the lives of people living with disabilities.